Autism Connect, we believe in action. So here we are in Maldives conducting our workshop about treatments for autism, occupational therapy and aquatic therapy. This is a little step towards making lives of children with autism better. So now I would like to present to you our conference at Maldives. Autism Connect is an association of parents and professionals formed to disseminate scientifically validated information about treatments for autism. When a child is diagnosed with autism, parents run from pillar to post for information and what exactly needs to be done. What we at Autism Connect have done is we have collated all this information at one place. So you just log on to www.autismconnect.com and there you go. You have all the details about autism. Now I'll just take you through our website. First and foremost, what we have listed is about autism. So what exactly is autism spectrum disorder? There are many parents who are clueless as to what exactly is autism spectrum disorder. So we have just added all that information as to what it is. And all the details and information that we have added are in a very parent-friendly and easy to understand format. Next is what are the signs and symptoms of autism? Now we all know that early intervention is the best way to support the development and well-being of a child with autism. Now, if we already know about the signs and symptoms, it would be easy for parents to analyze the child and detect the signs and symptoms early and start the treatments or therapies at a very early stage. So, for that, we have listed down all the signs and symptoms of autism on our website. Next we have listed is what are the causes of autism. Now we get a lot of calls at Autism Connect of parents asking us as to why is it that my child has got autism. Is there something that we have been doing wrong, or is there something that I've been eating something wrong? What exactly is the cause? So we have jotted down all the causes of autism. Next, associated problems with autism. So all the problems associated with autism, we have listed them down. We all know that children with autism have, some of them have sleep issues, depression, anxiety, inflammation, irritability, and all those kind of issues. So we have noted those as well. And now we have also added a list of diagnoses. So how to diagnose autism, we have put that list as well. So parents really do not know whether they have to do a blood test or a routine test, or they have to go to a doctor and what needs to be done. So we have put the list of all the diagnoses that need to be done to detect autism. We have a directory, which is a worldwide directory. It has more than 30,000 contacts of professionals. Now, how our directory works is we have listed all the countries and we have listed all the professionals as an occupational therapist, speech therapist, autism special schools, rehabilitation centers, associations, and the list goes on. So when you log on to the directory, just click your country, select it, and go to the category, as in you want a speech therapist, you want a school, just select your category and there you go. You have a list of all of it in front of you. We have resources on our website wherein we have listed a lot of books and applications that you can download and make use of for your child with autism. We have listed down a list of all the autism events happening all throughout the world. And we have also given you an option to register yourself for that particular event and participate. Next, we have also listed podcasts and videos, bookstores that are available all throughout the world. Also, toys and therapeutic accessory stores are also listed down. Now we come to the webinars. We keep conducting webinars, Facebook Lives and Instagram Lives every week twice. We invite professionals and parents to share their expertise and share their experiences with us. There is a particular time and we share the invite with all the parents and professionals so that they can attend the webinar. Now, supposedly at that point of time, you are not available, you're busy elsewhere. What you can do is you can just log on to our website and the recording is available for you. So you can watch that particular webinar or the Facebook Live whenever you have the time. And you can take back, we have a huge list of blogs on our website. And these blogs have been written by leading professionals giving in their expertise and also parents who share their experiences that they have gone through. And these blogs have been categorized into aquatic therapy blogs or speech therapy blogs or something related to children, school-going children. So there are different categories that you can choose and read those blogs. There's a lot of good information that you can make use with these blogs for your child with autism. We have free listing where professionals can list themselves on our directory free of cost. So if there is an occupational therapist or a speech therapist who wants their details to be seen by parents, so what they can do is they can simply add their details on our website and the details will be available for parents. Also, let me tell you, all the information that we have added on our website is available for parents and professionals free of cost. We now come to a very interesting part. Now, when a child is diagnosed with autism, wherever we go to doctors or online, anywhere we go, we're just told one thing. There's nothing that can be done. And we all are really taken aback. So here at Autism Connect, we have come up with a ray of hope. That is treatments for autism. So there are a lot of options of treatments and therapies that are available and people are unaware about. So we at Autism Connect are here to share all these options with you. Now I'll just discuss with you the topics that we will be talking about further. First is different investigations done for autism. Next is rehabilitation therapies for autism. After that, medical treatment for autism, alternative medical treatments for autism, and recent advances in the treatment for autism. Here is a list of all the investigations that you need to do for your child on the autism spectrum. First is routine blood test. Next is organic acid tests, heavy metal toxicity test, gut microbiome test, radiological investigations, and genetic testing and genetic counseling in autism. Here is a list of the routine blood tests that your doctor might advise. Tests like serum creatinine test, a CBC hemogram test, liver function test, vitamin B12 levels, vitamin D test, magnesium test, thyroid function test, blood sugar level test, etc. The benefits of the routine blood investigations are to measure and monitor the liver and rule out jaundice, to check the kidney function in your child, to check the glucose level, and also to check associated vitamin D deficiency, and to understand and detect chromosome abnormalities at an early stage of life. What are the side effects? Now, we all know we have done blood tests. Everybody, you sitting here, have done blood tests. So there is no any such adverse side effect of doing a blood routine test. Just in case if your child is hyperactive, you need to first speak to your physician and only then go for the test. Now, what is organic acid test? Organic acid test measures the nutritional and metabolic profile levels of organic components in urine of your child. A defect in a particular pathway can result in either accumulation or lowered levels of its byproducts. It is used in children, especially newborns, to check for rare inborn genetic defects of metabolism. Now, who needs organic acid test? Children who indicate weakness of arms and legs and who cannot tolerate exercise and get fatigue easily. If your child has abdominal pain, then you all need to get this test done. Individuals on the autism spectrum who show erratic, aggressive, and self-injurious behavior. Children with inborn errors of metabolism. Also, children who show anxiety or irritability. Children who show change in appetite. Also, if your child has nausea and vomiting, your child needs this test. What are the side effects of this test? It is a safe test to perform, but if a biomedical marker characteristic of genetic oxalate disorders are still elevated in the repeat test, consider DNA tests for the most common mutation of oxalate metabolism. Heavy metal toxicity test. This test helps to identify the presence of toxic metals in your blood. Toxic metals like aluminium, arsenic, lead, or mercury, cadmium. So we can see here there are these metals. Now these metals can be present in different kinds of things, like we can see here contaminated water, contaminated seafood, pesticides, smelted welding, children inhaling cigarette smoke. Also, it is present in kajal, in the radiator, in the lead-based paint, and smelter operations. Children also might be exposed to mining, contaminated fish, or water. Thallium, it can be present in the cement dust. Uranium can be present in shampoo or other hair products. Also, silver is found in seafood, metal, and chemical processing industries. Copper in dyes and bleaches. What heavy metals do is they damage the brain cells, and they damage the brain cells so much that they cause behavioral abnormalities, sensory and motor impairments. And these metals cannot be excreted effectively in children with autism. There are no side effects of this particular test. It's just that children should not consume seafood for 48 hours before the test, as it has high content of mercury. All these details will definitely be given to you by your medical practitioner. The gut microbiome testing measures the amount and types of microbes such as good bacteria, bad bacteria, and viruses in your gut via a stool sample. Radiological investigations measure abnormal electrical activity and risk of seizures. Now, there are two types of radiological investigations. One of them is the MRI, which is used to measure the function of the brain. And the other one is the PET scan imaging, which is used to detect the abnormalities in the brain function. Now, previously, there was no way to detect which part of the brain of a child with autism is less functional. But now, with the help of these tests, which is the PET scan, you can see here in front of you, you can actually jot down or see the actual problem area. Here in this image, you can just see the green areas and the blue portions of the brain. The green portions are the ones which are functioning normally, and the blue ones are the ones which are less functional. So now it is very easy to pin the area of the child where the issue is. There have been a lot of scientific papers that have been published in context to the PET scan imaging, but the first paper was published by Dr. Alok Sharma, and he was the one to introduce that with PET scan you can actually show the images of the brain functioning of a child on the autism spectrum. Genetic testing and genetic counseling in autism. Now, this testing is a medical test that identifies changes in the DNA. Rehabilitative therapies. Now, in rehabilitative therapies, we have conventional therapies such as physiotherapy, occupational therapy, speech therapy, psychological interventions, and behavioral therapies. We also have newer rehabilitative therapies such as aquatic therapy, music therapy, and dance therapy. A detailed session on rehabilitative therapies will be conducted by our therapist, Dr. Shruti Kamath. Medical treatments are also available for autism and to reduce the signs and symptoms. Medical treatments are psychotropic medications, hormone therapy, and neurotransmitters, also supplements and probiotics. We have put in a list of all the medications for management of behavioral symptoms, sleep, and management of epilepsy. But we would request you not to take these medications without the permission of your medical practitioner. So here you can see the list. Hormone therapy improves the social function in children with autism. And about neurotransmitters, by rewiring your brain, natural transmitter balancing undergoes impairment. What neurotransmitter does is the neurotransmitter therapy tries to undo this impairment. Now let's talk about the alternative medical treatments for autism. The first one is Nemchek protocol. The protocol is made up of 4 components, which is repair, restore, reverse, and maintain. Now this was introduced by Dr. Nemchek. Dr. Nemchek believes that many children with neurological dysfunction and developmental delays are suffering from inflammatory damage that leads to cumulative brain injury. And this treatment, what it does is, it has 2-step process which is aimed towards rebalancing the bacteria in the intestine and the omega fatty acids. This allows the brain to encourage healing and function efficiently. Nemchek protocol is needed by children with autism who have symptoms such as motor, sensory, and speech delays, attention and learning disabilities, gastrointestinal issues, hyperactivity, and children with autism having anxiety. The ingredients that are used in the Nemchek protocol are very organic, hence it is very safe to use. Also, it is very inexpensive and very effective. Now let's talk about homeopathy. Homeopathy believes that the body can cure itself, and homeopathy uses natural substances like plants and minerals to make the medicines. So it is a very safe treatment to be given. But the only thing is that only certain signs and symptoms of autism can be managed with homeopathy. Also, homeopathy is very easy to be given to children as it doesn't have any odor, and it does not, you don't get addicted to these medications. Hence, you can use these for a longer duration to reduce the signs and symptoms of your child on the autism spectrum. Ayurvedic treatment for autism. Now, we all know Ayurveda is one of the ancient branch of medicine. Ayurveda believes that good health happens when your mind, body, and spirit are perfectly in balance. Any imbalance can lead to health problems. Ayurveda is a very safe treatment that can be used for children on the autism spectrum, and Ayurvedic treatment has a very good potential in reducing the symptoms of autism without causing any adverse effects on the growth of the body in the growing stages. There are no proven side effects of Ayurvedic medication as they are made from natural substances. Acupressure and acupuncture is another alternative medicine technique that can be used. Acupressure uses pressure points that are applied on certain points of your body and your body heals. Acupuncture uses needles that are put at certain points of your body and it helps heal your body. Acupressure and acupuncture reduces hyperactivity in children with autism, improves blood circulation, provides relaxation and pain relief. Also, it improves sensory issues, including tackling hypersensitivity, reduces self stimulatory behavior. A few side effects are because of the acupuncture, which uses needles, there might be a local bleeding, but it can stop in a while. Sometimes children might be intolerant to this procedure, so that's another side effect. Otherwise, there are no such major side effects of this treatment. Also, minimal pain due to the pressure that is used during acupressure. So there might be some local pain which can subside in some time. Deep tissue mobilization is a massage treatment in which a therapist manipulates muscles and other soft tissues of the body to improve the health and overall well-being. It helps in blood and lymph circulation. Also, it helps in relaxation and normalization of soft tissues, which releases nerves and deeper connective tissues. There are a few side effects to this treatment. They can be muscle aches, headaches and migraines, fatigue and sleepiness. There also can be nausea and bruises on the body. Robot assisted therapy in autism. Robot assisted therapy is a type of therapy which uses robots to assist individuals with special needs through social interaction. It helps enhance the outcome of traditional human therapy and has been extremely successful in autism. Now let's talk about the recent advances. In the world of research, there are newer and newer treatments that keep coming up and we are not quite aware about. So let's talk about those treatments. Now, the first one is stem cell therapy in autism. Now, what are stem cells? Stem cells are the cells that have the capacity to self-renew and generate multiple mature cell types. These stem cells possess the ability to repair, replace, and regenerate. And for a detailed medical explanation about stem cell therapy, we have Dr. Amruta Paranjpe, who will explain you in detail.
Good afternoon, everybody. Before understanding what is stem cell therapy, it is important for us to know what are stem cells. So, stem cells are the baby cells or the precursor cells that have the ability to regenerate into different types of tissues. So, when we are born, when the baby is formed in the womb, it is made from one cell. That one cell divides and regenerates and replicates into multiple types of tissues to form the entire body. So that is the regenerative potential of the stem cells, which is harnessed into stem cell therapy. So these cells have the ability to replicate into themselves or replicate into different types of tissues as well. Now, when stem cells are used, there are two types of it. One is autologous and the other is allogenic. Autologous means the cells are taken from the same person to whom the cells are injected into, and allogenic means the cells are taken from another person. Autologous cells are definitely more safe as compared to allogenic cells, because in allogenic cells the source is from another person's body and there is a risk or there is a chance of immune rejection when they are injected. But autologous cells are safe because they are taken from the person's own body and injected back into the same person. So using stem cells to repair the damage in the brain tissue or in any tissue is stem cell therapy. I have come across various patients who have been treated with stem cell therapy in neurological disorders. And some of the important properties of stem cells that help or that are beneficial for us to when we do the treatment is, one, they multiply into different types of tissues. The other is that the other effects are called paracrine effects or paracrine mechanisms, which means that they have an effect on the neighboring cells where they are injected, and those neighboring cells also contribute to the repair of the damaged tissue. and they secrete certain positive chemicals, some cytokines, that help to reduce the inflammation in the brain, and it also helps to stimulate the local stem cells. So the stem cells that are already there in the brain are also stimulated to do the repair work, and they also help to improve the blood supply of the brain. So the blood supply of the damaged part, or blood supply to the damaged part of the brain, is reduced when there is injury or inflammation, and the stem cells actually help to improve the blood supply as well. They also have one interesting property, that they can migrate to the site of injury, or they can home on to the damaged tissue in the brain. Now, what does this mean? Whenever there is a damage or injury to the brain, there are certain chemicals released. Those are the inflammatory markers. And these chemicals attract the stem cells towards the injured part, so the injured part can be repaired. When there is no injury, there is evidence that there is chronic neuroinflammation in disorders like autism as well, and because of which these stem cells, when injected, are automatically attracted to the part of inflammation, or to the brain, the parts that are not functioning very well. So these stem cells then secrete all these positive cytokines, growth factors, chemokines, so that the blood supply to that tissue can be improved, the function of that tissue can be improved, the local stem cells are stimulated, and further damage can also be prevented. And the repair process is facilitated through these mechanisms. The adult stem cells, or autologous stem cells, can be taken from an adult individual as well. So there are different types of stem cells based on where we take it from. The adult stem cells are the stem cells that are found in a human body after 1 year of life, and it is available in several places. The most common source of it is bone marrow. For autologous treatment, the cells can be taken from the bone marrow. So the bone marrow is extracted, then the cells are separated through centrifugation from the bone marrow, and then the useful cells are injected intrathecally, that is in between the fluid that surrounds the brain, at a lower lumbar level, or in the lower back. So through injection we can insert these cells into that fluid. The fluid is called cerebrospinal fluid, and it circulates all over the brain and the spinal cord, and it's a nourishing fluid. Like we have blood, there is another fluid in the brain that circulates. Once injected into this cerebrospinal fluid, the cells are automatically attracted to the part of the brain that is damaged or injured. So, in the evidence, or in the literature that is available on use of stem cells for treatment of autism, we have seen that so there were clinical improvements that were seen after this type of stem cell therapy, where the aggressive behavior and hyperactivity of the children had reduced, their eye contact had improved, their speech and communication improved, attention span improved, their social skills were also better. And in addition to that, they also showed that there was improvement in the metabolism of the brain. And so this was shown through something called as PET-CT scan. PET-CT scan is a scan that is done to identify the function of the brain, or metabolism in different parts of the brain. Like MRI shows the structure of the brain, PET-CT scan actually helps us to identify which part of the brain is functioning how much, and to identify parts of the brain that are not functioning normally, or that are functioning below the normal level, which is also called as hypometabolism in the brain. So this is typically shown in the PET-CT scan in blue color. So when you see the PET-CT scans, you can see that there is blue color part of the brain which is hypometabolic, which means it's functioning less than normal. And after stem cells, it was noted that that particular part, or those particular parts of the brains, actually started improving, and their metabolism increased, and their function was better. So they turned from blue, signifying hypometabolism, to green, signifying normal metabolism. So there are papers published with this PET-CT scan evidence. So as per the publications that are already available in the literature. The first study that was published was from India, which that documented the effects of stem cell therapy in autism, and subsequently a study was published by China, then Ukraine, and then United States, and then one more paper was published from India. So based on these publications, there are certain institutes that have been listed by Autism Connect, those institutes who have published their work. So the first paper that was published was by Sharma et al. By Neurogen Brain and Spine Institute from India. And subsequently, there was a paper published by Shandong Jiaotong Hospital in China, then MCEL in Ukraine, the Duke University in USA, and Sutter Institute of Medical Research in USA. So this is available literature on stem cell therapy in autism, and all of these published papers have shown that stem cells have the potential to improve the brain metabolism and to improve the clinical impairments or clinical symptoms and signs that are seen in children with autism. That stem cell therapy can be beneficial for these children.
Now, who should actually consider stem cell therapy? Children with autism who have received rigorous and regular multidisciplinary rehabilitation and still are showing symptoms of autism should consider stem cell therapy as a clinical option. Next, we talk about is HBOT in autism, which means hyperbaric oxygen therapy in autism. In this treatment, what is done is the body is flooded with 100% oxygen, and generally what happens is there is only oxygen in the hemoglobin. When HBOT is given, oxygen is carried by plasma in addition to the hemoglobin. And in the bargain, what happens is it improves oxygenation of tissues throughout the body. And then what happens is, now we can see here, initially the oxygen is carried only by the RBCs at normal pressure. But when HBOT is, that is the hyperbaric oxygen therapy is given, oxygen is carried by the entire blood when given at high pressure. Now we'll see the benefits of hyperbaric oxygen therapy. First, it strengthens the immunity, it stimulates oxygenation, improves metabolism, increases your energy levels, reduces fatigue, and improves overall functioning of your body. The next treatment that we are going to talk about is ozone therapy in autism spectrum disorder. In ozone therapy, what is done is a combination of oxygen and ozone in the ratio of 98:2 is put into your body. Now what ozone does is, ozone is an excellent antioxidant, anti-inflammatory, anticoagulant, and it is a germicide. So in this procedure, 100% medical grade oxygen and ozone combination is put into your body to modulate cellular responses. Now we'll talk about how ozone works. So what ozone does is it activates the antioxidant system of the body and reduces the oxidative damage at cellular levels. Then it reduces the inflammation in the brain and the body. Next, it improves the gut health as it is an excellent germicide. It has potent anticoagulant effects. Also, it improves the oxygenation throughout the body and the brain. Biomedical treatment in autism is an alternative medicine which uses a combination of dietary modifications, digestive enzymes, multivitamins, and mineral supplements. It improves a lot of signs and symptoms in children with autism, just like better digestion, improved appetite, it improves the attention, and it improves the social interaction, adaptability, and social play. Also, there are a few side effects such as nausea, fatigue, nervousness, and daytime drowsiness. Neurobiofeedback in autism. What is neurobiofeedback? It is a technique used to enable individuals to change their brain activity by using an instrument which provides information on the activity of the brain. The goal of neurobiofeedback is to improve behavioral or cognitive processing related to brain connectivity. It helps in reducing stimming, and it also has other benefits such as improving concentration and focus. It improves clarity of speech patterns. Also, it increases imagination and creativity. There are a few side effects such as nausea, anxiety, depression, headaches, dizziness, and social anxiety. Magnetic resonance therapy in autism. This therapy is a drug free and non invasive treatment option for autism. The treatment is personalized based on each individual's brain patterns. The benefits of this therapy are that it gives a better sleep quality, it improves mental focus, regulates mood, and it also improves social skills. As it is a non invasive therapy, it is very safe to use. However, some patients may experience mild headache, which can be treated with medication. There is also a very low risk of seizures. Now, to make things easier for our parents and professionals, what we at Autism Connect have done is we have made a book of treatments for autism that will be available on Amazon and Flipkart soon. Also, a free soft copy of this book will be available on our website, and the detail will be shared with you very soon. Now, let's come to the most interesting part of our talk today. So, we already discussed what Autism Connect has done in the past, what Autism Connect is currently doing. Now, we would love to introduce what Autism Connect is going to do in future. So, here we present to you our new project, that is the digital rehabilitation platform. So, what if I told you a therapist is just a phone call away for you? Yes, my dear friends, digital rehabilitation platform that Autism Connect is building will make this possible. So, in the pandemic, we saw that therapies are also possible online. So, here we can see previously we used to go to a therapy center to the therapist to take therapies, but now things have changed. Technology has changed, and we can take therapies being at home. So, in the digital rehab setup, what will happen is the therapist will give instructions to the mother, and the mother will do the therapies onto the child. So, in the bargain, the mother will also learn all these therapies. And as we all know, a mother knows her child best. She is the best judge, so she will be able to analyze the child perfectly. Also, when the therapist and the patient meet via computer instead of an office, the child is at comfort because he is at his own home environment. And as the child will be at home, they will be very less vulnerable to any infections that they might catch when they go out of their homes. Also, in such a setup, you will not miss your therapies. So the development of your child will never stop. So for setting up a digital rehab at your home, you just need these few simple things, that is a good internet connection and speed, a laptop or a computer with a webcam, and microphones and audio, a few stationery items like paper and a pen, and a few recommended therapy toys that your therapist might recommend. Thank you so much, all of you, for listening in, and I hope I was able to convey my message to you. Yes or no, everybody? Thank you so much. Now I would like to invite Dr. Shruti Kamath to speak about rehabilitative therapies.
How many of you have heard terms like hyperactivity or ADHD? How many of you have heard terms like cerebral palsy? Okay. And how many of you have heard terms like learning disability or slow learners? So I just want to understand, in this island of Thulushtu, is this the only school? And all children with learning difficulties, do they come to the same school? Good afternoon to one and all, and thank you so much for being here. My name is Dr. Shruti Kamath, and I'm an occupational therapist by profession. Today I'm going to talk about comprehensive rehabilitation for children with special needs. So what is comprehensive neurorehabilitation? Neurorehabilitation that helps the affected individual with neurological disorders and his and her family members to cope up with the condition and enables them to live and work as normally as possible. What are the type of neurodevelopmental disorders that we see in our hospital? It includes autism spectrum disorder, ADHD, cerebral palsy, intellectual disability, children with communication, speech and language disorders, and genetic disorders. The neurorehabilitation team in our hospital includes occupational therapists, psychologists, speech therapists, physiotherapists, special educators, music and dance therapists, and along with that, we also have aquatic therapy. So this is the occupational therapy department of our hospital. As the term says, occupational therapy, something that's related to one's occupation. So what do you think is an occupation of a child? Yes, that's right. The occupation of a child is to play, learn, write, read. The pediatric occupational therapist helps children with special need and trains them in activities of daily living such as buttoning, dressing, bathing. They also teach skills that require for handling of small objects, big objects. Along with this, they also do a lot of cognitive retraining, and also provide activities that help to improve concentration and memory. They use different techniques to the child to perform the task. A lot of them use daily checklists so as to improve the child's planning abilities. Different techniques are used to perform tasks, and some of them also prescribe splints for children for handwriting. Next, we are going to play a quick video about how the occupational therapy department helps children with special need in our hospital. Most of the occupational therapists who works with children with autism, they use a technique or therapy that is called as sensory integration therapy. So sensory integration or SI therapy is basically used for children with sensory issues like autism, sensory processing disorders, and ADHD. They're all used to improve the ability to behave meaningful and consistency in their day-to-day environment. What is SI therapy? So basically SI therapy uses different sensory inputs and different intensities, frequency and intervals to modify a child's response and learning. We're going to quickly play a video wherein our therapists are working with children and it shows how SI therapy. Now we are going to discuss about pediatric psychological intervention and rehabilitation. So pediatric psychologists, their main aim is to improve behavior. They do family counseling, psychoeducation, psychological testing, goal setting, and they also work with the child to improve his or her self-esteem and self-efficacy. Psychologists also do anger and stress management. They do client-centered therapy, that is cognitive behavior therapy, and teach relaxation and mindfulness techniques. Most of the psychologists who work with children with autism, they use ABA, that is applied behavior analysis. So ABA is basically an application of behavioral principles. Now it is to everyday situation that will over time increase or decrease targeted behaviors. This is to acquire a variety of skills such as language, self-help skills, play skills, and in addition, ABA is also to decrease maladaptive behaviors such as aggression, self-stimulatory behaviors, and self-injury. Some of the other strategies that an ABA therapist uses is visual schedules, picture boards and flashcards, and first and then cards. Prompting, most of the therapists, they use prompting in their therapies. Now prompting can be visual, verbal, gestural. Now you can see in the slide, one of the therapists is working with the child and she is using gestural prompts. We're going to quickly run through videos which are going to help us understand prompting. Psychologists also use reinforcers and punishments. Now, reinforcers can be positive and negative both, as well as punishments can be to improve or decrease a child's behavior. Other behavior modification strategies such as extension and social skills training that we do in our hospital. What are the other approaches that are used in our hospital in autism, Down syndrome, and ID? We do psychological testing and assessment, that is IQ testing. We do family counseling in our hospital. We're going to run through a video of our psychology department. Next is speech therapy. So speech therapy in neurological conditions, it provides prevention, assessment, diagnosis. The treatments, the services to the children and adults who have difficulty in speech, language, social communication, cognitive communication, and swallowing. These are few oromotor exercises and proprioceptive neuromuscular facilitation that is given to children. It includes chewing, sipping, swallowing, sucking, blowing. Some of the tools, that is orosensory awareness tools, Chewy tubes and Z-Vibe that's used. As you can see in the slide, how a therapist is working with children, especially children with special needs, to teach them body parts, picture identification, recognition, color and shape concept. We're going to run through a video which a therapist is working with a child. Next is the special education department of our hospital. So special educator works with children with special needs to teach skills and to improve their academic areas such as writing, learning. It can be number concept or shape concept. We're going to run through a video where a special educator is working. on one of the fun therapies, that is music and art therapy, which is widely done in our hospital. It's majorly done in terms of group therapies. So as you can see in our video, where children of different abilities are being taken into account. So group therapy is widely done in our hospital. It is fun, and as you can see, children with different abilities are participating in the group therapy. We'll discuss about pediatric physiotherapy and rehabilitation. So pediatric physiotherapist basically deals with children with cerebral palsy to improve their balance, transfer, gait and coordination. They use a specific approach that is called as NDT, that is neurodevelopmental treatment. Now NDT includes elongation, alignment and activation. I'm going to quickly run through slides which will help us to understand this better. Elongation, which means to stretch the muscles. Alignment, that is to correct the muscles. And activation, which just means to strengthen the muscles. So here the posture correction is done in the sitting. As you can see, a child is sitting on a CP chair and how posture is corrected on a standing frame. Most of the therapists, especially physiotherapists, and in children with CPs, they use appropriate spins and walking aids so as to make the child independent. We're going to run through a video where a therapist is working with a child on CP. The beauty of our center is that we have comprehensive rehabilitation under one roof. All type of therapies are available for children under one roof. Let's go through the departments. This is the physiotherapy department, the occupational therapy department, the Autism Child Development Center. Oh, wow, as you can see, this is our beautiful ACDC center. Some of the special facilities that we have in our center: aquatic therapy, the sensory integration therapy room. Thank you so much for being here. Thank you.
Good afternoon, everybody. I am Dr. Amrita Paranspe. I am certified physiotherapist from Manipal University in India, and I have completed my master's in physiotherapy from United Kingdom, from Sheffield Hallam University, after which I did my certification in aquatic therapy from Switzerland, and I'm also certified as a Vatsu practitioner with Worldwide Aquatic Bodyworks Association. And it is my great pleasure to come and speak with all of you in this beautiful country, Maldives, about benefits of aquatic therapy for neurodevelopmental disorders. And I think it's very special for me to come here and speak with all of you because Maldives is surrounded by water and you have access to such wonderful water bodies all over you. So there are lagoons and there are shallow beaches where aquatic therapy can be done. So I see wonderful opportunity in Maldives, moving away from the traditional or the typical setup of aquatic therapy. We could actually explore what other options can be tried, and I think those tremendous opportunities are really exciting for me. So, to begin with, I want you to get used to aquatic therapy. The other names for aquatic therapy, aquatic therapy is also very commonly known as hydrotherapy. Many of you might have heard of it as hydrotherapy, aquatic exercises, aquatics, hydratics, balneotherapy, water exercises, water therapy, and so many other names. And but it all means the same. It essentially means doing exercises or rehabilitation, which is goal oriented, uh, by a supervised, with under the supervision of a trained aquatic therapist for various purposes. It can be aquatic therapy can be used in various disorders like musculoskeletal disorders from knee pain, back pain, arthritis, to neurological disorders like stroke, spinal cord injury, head injury, cerebral palsy, and neurodevelopmental disorders as well, like autism. So the range and the scope of aquatic therapy is wide, but today I'm going to specifically talk about how aquatic therapy can be beneficial for children who have neurodevelopmental disorders. So why is there a need of aquatic therapy in neurodevelopmental disorders? We already have so many other therapeutic modalities available for these children. Then what is it different or special that aquatic therapy provides? Aquatic environment is a very unique environment, and it has a lot of potential, it has a lot of benefit to offer to everybody who chooses to exercise in that. What additional advantage does it give? So, when we talk about neurodevelopmental disorders that have certain physical impairments like cerebral palsy, where children do not have the strength, or the children may not have proper tone in the muscles or the coordination in the muscles, they may have their movements may not be very well coordinated, um, very well planned, and they have difficulties in holding their necks, in sitting up, in standing, in ability to in being able to walk, climb stairs, run. So all of these physical movements are very difficult for them. They may be delayed in achieving these, or they may not be able to achieve it at all. So how does aquatic therapy benefit these children? So the first and foremost is, or the biggest enemy of these children is gravity, because we have to fight against gravity every step of our life. If we want to stand, if we want to stand tall, if we want to sit tall, then we have to keep fighting with the gravity. The only position in which we don't have to fight gravity is when we are lying down on the bed. And all of our functional movements, there is a component that is against gravity movement. And this is the very big challenge or difficulty for children who have muscular weakness, or children who have movement disabilities, like in case of cerebral palsy. So water helps us to defeat gravity. There's a unique property of water called buoyancy, about which I will talk to you in detail later on, which helps us to defeat gravity. And therefore it facilitates movement. Now, one basic principle of learning how to move. So when a child is born, the child performs involuntary or voluntary movements, but that are not purposeful. So if we have to learn a purposeful voluntary movement, which is task oriented, function oriented, or goal oriented, then it is done through the process of motor learning. Now, for motor learning, first the movement needs to be performed. Our body should have the basic ability to perform that movement, which means the body should have enough strength, enough length of the muscles, all the senses should be working in coordination to perform this movement. The tone of the muscles should be good. So all of these factors affect performing a particular movement, and they hinder, if there is an imbalance or there is an impairment in any of these factors, then it hinders motor learning as well. So if we want to learn anything, we have to first start doing some part of it. We then do more complex part of that task, And then together we practice and practice and practice, after which we master a particular thing. So same thing happens in movement. Unless we repeat a movement, our body cannot remember it, our brain cannot remember it, and it cannot be mastered. So when a child is born, it takes almost 6 months for the child to learn how to hold the head or how to have a neck control. It takes almost 8 months for the child to be able to sit up, almost a year for the child to be able to stand and walk. And before the child is able to do this, the child has attempted this at least millions or thousands of times. So every day the child just keeps practicing and getting ready to perform these movements through various sensory inputs and through various motor inputs by trying different ways of doing that particular movement. This freedom is not is not available for children who have impaired who have impaired muscle strength, or who have impaired muscle tone, and they cannot perform these movements on land, so they don't even get the opportunity to learn the movements. In water, they get this opportunity, and because of that, water promotes learning new movements as well. It promotes motor learning. When they're able to perform the movements, water also gives some amount of resistance. So water can be used to assist as well as resist a movement, which brings about strengthening of the muscles. There are certain physiological effects of water on our body, because of which it also facilitates better blood supply, better circulation. It promotes certain chemicals, secretion of certain chemicals that help in reducing inflammation, reducing pain, in promoting nerve growth. And because of all of these, there is reduction in the fibrosis. Fibrosis is a process where muscles are, if the muscles are spastic or tight, there's a possibility of deformity formation because of this process. And in water, that can be reduced. Water helps to reduce inflammation as well. Now, when these children are not able to perform movements very effectively, the body finds out alternate ways of achieving these movements and tasks, or performing these tasks. So we see a lot of children are not able to stand erect, but they can stand with their knees bent, their feet curled. So there is a bit of a crooked posture sometimes that is seen. And these postural abnormalities, although they provide postural stability to the child so that they can walk and they can do functional movements, they are very harsh on the joints of the child, because the joints are always under compression. And because of this, in long run, when we see them, when the child becomes an adult and an older adult, and then moves into the early 40s or 50s, they may start having a lot of joint issues, joint pains, or even much earlier. Sometimes children start showing joint pain and joint dysfunctions at the age of 20, 25, 30 as well, based on how much is the postural compensation required to perform the movement. In water, because of the buoyancy, there is a relative weightlessness, which means that the joints are not loaded as much as they are loaded on land. And also, because water supports, the postural compensations can be minimized or can be reduced. And therefore, it reduces joint dysfunction as well. And because children are able to perform better movements, it improves cardiovascular endurance, because on land they don't have the opportunity to challenge their heart, because they cannot perform good movements or a lot of movements. We cannot give them activity that actually challenges the cardiovascular system and strengthens the cardiovascular system. And because of which, as the children grow, they may face certain difficulties or certain problems with the cardiovascular system or their heart as well. In water, we provide them that opportunity, and so we can improve the cardiovascular endurance. We can also improve the strength of their respiratory, that is, muscles required for breathing, and the endurance of the muscles that are required for breathing. Water can also improve their balance between the sympathetic and parasympathetic systems. This is particularly important for children who have autism. we see that there is an imbalance between these two systems, and because of which there can be a lot of symptoms that are observed in autism can arise from this imbalance. In water, there is also a stimulation of different senses of the body, like the touch. When the water flows on a child's hand, there is a lot of sensory stimulation of touch. There is a vestibular stimulation when the children, because the children are unstable in the water, when their feet are not touching the ground and they are turning, twisting, moving in the water, there's a lot of vestibular stimulation, which we can achieve on land by making them sit on a ball or a swing. And so much of equipment is required to be able to provide this stimulus, but in water it can very easily be given. Water also gives an auditory stimulus. It makes sound when we move through it, when we tap on it, when we do exercises. It gives certain auditory and visual stimulation also. So and it has a compressing effect on the body, which, so the joint, there's an water encircles the body, so it compresses the body from all the sides, and that is called as hydrostatic pressure. This pressure also gives a proprioceptive stimulus for the children. So there is a lot of sensory stimulation that can be given, and sensory modulation can be achieved in water as well, quite easily as compared to on land, so which helps greatly for children with autism. So what are the properties, physical properties of water that make it a good environment? It is colorless, it is transparent like air. So we can see our, our patients, we can see our children when they are in the swimming pool very easily. It is odorless, so it's a very neutral environment. It's a good solvent, good conductor of heat and electricity. We have to be careful about the last property, because it's a good conductor of electricity. We must steer clear of any electrical appliances near the swimming pool or the therapeutic area. Now, there are certain other properties, physical properties of water that are extremely beneficial, or those are the properties of water that help us to choose water as a medium for our therapy, or as an environment for our therapy. The first is density. So, density of water is 1. I'm not going to get into the tedious physics aspect of any of this. So, density of water is 1 as compared to the density of air, which is 0.0013, which is about 800 times lighter. What it means is, if I move my hand in the air, I don't really perceive that movement very well. I don't really feel the air moving against my hand that well, or I don't really understand the movement, because there's not much of sensory feedback that I receive. But to perform the same movement in water, that would be very difficult, maybe, depending on which movement we are performing, or it may be easy depending upon in which direction we are moving our hand. But it would definitely give a lot more sensory stimulation than on the air. We will understand how our muscles are moving, how much pressure they need to exert, how much they need to contract, and when we move our hand, we are able to understand the movement much better, which gives the feedback to the brain for learning the movement better. So density is the property that helps uh, enable to that gives a resistance to the movement in water and enables us to learn the movements much better. Then the most important of the properties, or what makes water most favorable as an environment for us, is the buoyancy. Buoyancy is an upward force that counters the gravity. Gravity is a downward pull. Buoyancy is an upward push, which means it negates the effect of gravity and gives us a sense of weightlessness. That's why we feel very light in water. When we get inside the pool, we feel very light, because the effect of gravity is not there anymore. Our joints are not burdened by gravity anymore. And therefore, it is easier to perform movements. It's easier to stand in water. It's easier to jump, to do a lot of which activities that may be perceived very difficult on land, we can easily do it in water. So this buoyancy has a very important role to play when we look at aquatic therapy. Cohesion and adhesion. This is an attraction between the water molecules with each other and with the substance that they are in. So with the pool walls, with the bodies of the patients that are inside the water. And water these are very strong forces that water molecules are attracted to each other in a quite stronger way as compared to the air molecules, and therefore it's not easy to deform water. It is not easy to displace through water because they are very tight together. So when we move in water, we feel more resistance for that movement, which gives us better feedback, gives us opportunity for strengthening, and that's why we want to use this particular environment. Hydrostatic pressure, it's something I've already spoken to you about. It's the compression that a person or any object immersed in water experiences while immersed in water. And one very good thing is that it is uniform from all the sides at a given depth. But as the depth goes higher, or as we go deeper in water, this pressure increases. And at the depth of 4 feet, it is almost as good as diastolic or more than diastolic pressure, which helps in reducing the edema, or which helps in reducing the extracellular fluid that is present in the tissue, and helps us to reduce swelling, which is most often seen in patients who have physical disabilities. The next property of water that is useful in aquatic therapy is the compressibility, rather poor compressibility of water. Water cannot be compressed, which means it is difficult to displace the water again. And that provides the resistance for any movement, giving the necessary strengthening stimuli, giving a very good proprioceptive feedback, giving a very good sensory feedback for the brain and the muscles to learn the movement. Refraction. Now, this is a quality of water that the therapist needs to be precautious about, because when we see something that is underneath water from above the water, it may look crooked because of the refraction of the light rays, and therefore sometimes the deformities can be perceived to be worse in water, or deformities that are not there may be seen when you're seeing from the top, and so the therapist needs to be aware about this. So what are the beneficial effects of aquatic immersion? Now, just immersing oneself in chest deep level of water has a multi-system effect on the human body, which means it affects almost all of the vital systems of the human body, and it has a good positive effect on that. And this can be used for the therapeutic purposes. How can we how can we know what are the effects that we see on different systems? So first is the cardiovascular system, which is our heart and the blood vessels and the blood that is being pumped throughout the body. So we see that by just immersion in water, because of the hydrostatic pressure, the blood that is pulled into the different extremities, that is into the feet, into the arms, hands, that is pumped back to the heart, and therefore heart has more blood to pump back out, which improves the circulation, which improves the blood supply to the whole body. Because more blood is pumped through the heart, there is better perfusion of the brain, there is better perfusion of the deeper muscles. And when there is better perfusion of the brain, the healing, the repair of the brain, the development of the brain, all of this is going to be much better. What are the effects on the respiratory system? That is the lungs and the breathing ability of an individual. So when we are immersed in water, the work of breathing increases. What it means is that there is resistance for breathing, because water compresses us from all the sides, and therefore there is a resistance for breathing, which means that it is difficult for us to breathe in water. So all of us, when we get into water, we gasp, we do this as soon as we get into the water. So that is because the work of breathing suddenly increases and we find ourselves short of breath. But then our body adjusts to the increased work of breathing and we start breathing normally. We need to be precautious with people who have respiratory muscles affected, or whose breathing is very shallow. These are the people who may find, or patients who may find it very challenging to breathe when they are inside the water. So we need to be precautious about this. What it also provides us is a wonderful opportunity to treat the respiratory muscles. or to do respiratory rehabilitation for these patients. When they come out on land, it's like running on sand. So when we run on sand, because the surface is more challenging than hard ground, we perform much better on hard ground. So if a patient or a child is trained in water, their respiratory system is strengthened in water, then when they come back on land, their respiratory system works much more efficiently. And the work that they have to do on land is also significantly easier for the respiratory muscles. So water provides strengthening of respiratory muscles. This automatically, or this provides a better oxygenation of potential. So we are able to breathe better. So the air exchange in the lungs is better. Circulation has improved. Ability of breathing has improved. So more air is going, more oxygen is going in the lungs, more blood is going to the lungs, which means that the oxygen assimilation in the blood is better. And so the whole body is oxygenation also improves. So the brain is not only better perfused, but it is better oxygenated as well. So we can see the effect here. So this child is able to breathe around 1700 ml of air on land, but in water he's only able to breathe around 1250. So that is the difference, or that is the challenge that the respiratory system faces. And those who have very poor inspiratory capacity, the therapist needs to be extremely precautious not to give chest deep immersion for these patients. Those who have poor respiratory endurance or muscle weakness of the respiratory muscles should be introduced to water gradually at shallower depths to begin with, and then gradually the depth can be increased as their respiratory muscle strength and endurance improves. What are the effects on renal and endocrine system? So the first and foremost is it has an improved kidney function, because the circulation is much better. The kidney function is also better. The toxic substances are thrown out much better way than otherwise. This leads to increased urine output. This is something a therapist needs to be wary of or be precautious about, because small children who do not have bladder bowel control, who are not toilet trained, they may want to go to the toilet much sooner than on land. And if they are not able to indicate, then the therapist needs to either have a way to identify when they want to go to the toilet, or reduce the duration of the session so that there is no risk of contaminating or soiling the pool. So in water, when after water immersion, there is increased dopamine secretion noted in the brain and in the blood. So what this means, dopamine is a happy hormone. Dopamine is a hormone that is responsible for smooth movements. So when they are immersed in water, this hormone is secreted more as compared to the land. Now when this happens, obviously that's why water aquatic therapy is more enjoyable for children. It's more fun, not only for children, for adults. All of us love to be in water, and we enjoy being in water. So that is because of this hormone. This hormone is also a happy hormone, the hormone that gives you a sense of happiness and gets you into a good mood. This hormone is also important for movements. So lack of dopamine causes Parkinson's like symptoms, or Parkinson's disease, which is mainly inability to perform movements in a smooth, controlled, coordinated manner. It is also seen in children with dyskinetic or dystonic CP, that the dopamine secretion might be affected, because the brain area that is affected is responsible for secreting this particular neurotransmitter. So in water, we have an opportunity to affect not only the movements externally, but on a systemic level, we can improve their brain function, and we can improve the physiology of the body as well, which can help us to achieve better movements, and which can help us to push them more give them more advanced, more challenging actions and tasks, which otherwise on land will not be possible. Aquatic immersion also increases serotonin secretion. So in autism, we see that serotonin levels may be low. So higher levels may improve the symptoms of autism while they are immersed in water. It also improves endorphin secretion. So again, these are happy hormones which is responsible for good adherence to aquatic therapy. Now, what are the effects on musculoskeletal system? As we have previously seen, aquatic immersion reduces joint compression because we feel a sense of weightlessness because of the buoyancy which is acting against gravity. Our joints are not as compressed as before. Therefore, there is because of reduced joint compression, the proprioception that the joints have may be slightly reduced as compared to land. So we don't feel our legs and hands when we are in water and not moving. But when we move, then the proprioceptive feedback is much more as compared to on land. So the dynamic proprioceptive inputs are more or improved in water. There's greater freedom for movement, which gives the opportunity for better motor learning and for better strengthening of the muscles. And it also reduces the pain perception. So there's an analgesic effect that the water has. Could be because of the sensory stimulation, the continuous touch sensory stimulation that is there in water. Could be because of all the hormones that are secreted. Could be because of the better blood circulation, better oxygenation. There could be many multiple contributing factors, but it is noticed that the pain perception in water is much less. Now you can see here there's a child who is not able to perform extension of the knee very well on land. But the same child when immersed in water is able to perform this movement in complete range. It obviously doesn't mean that the muscles became stronger suddenly. It just means that water as an environment has facilitated this movement. The buoyancy is helping this child to move the leg much better. What opportunity does this provide to the child? So the range can be maintained, which reduces the muscle tightness, fibrotic processes. The muscle fibers are used throughout the whole range, and therefore there is lesser wasting and loss of strength. We are able, and the most important benefit I feel is the confidence boost that the children get, or the sense of accomplishment that the children get for being able to do activities that otherwise they cannot do on land. So this is another example. This is a gentleman who is not able to stand up on land because of the muscle weakness. But if we see in water, he's able to stand up without any support and with much lesser effort. So once again, the muscle strength hasn't increased suddenly, but water has facilitated performing this movement and has made it much easier to perform this movement. So how much weight reduction do we feel when immersed in water? So if a person is immersed in shin level water, then the ankle joints will only perceive 85% of the weight. So if somebody weighs 100 kilograms, the ankles when we are in shin deep water will perceive only 85 kilograms. When somebody is immersed in knee deep water, then the ankles will only perceive 65 kilograms. At waist deep water, the ankle and knees will only perceive 50 kilograms. At the chest deep immersion, it will be 25 to 30 kilograms. And at neck deep immersion, only 10 kilograms. So there's a 1/10 reduction in the weight or the perceived weight by the joints because of buoyancy, which allows for a great decompression of a great opportunity for decompression of joints. When the joints are decompressed, the synovial fluid flows much better. The circulation of joints can be much better. The oxygenation of joints can be much better. The joint cartilages, the intra-articular structures, all of those can be much better, and it prevents or it helps to maintain the integrity of the joints as well. So nervous system, I think I have expressed this multiple times that water gives a very good sensory stimulus. So the skin sensors, the nerve endings are affected, including temperature, touch and pressure receptors. So because typically a therapeutic pool is temperature controlled, we generally do therapy in warm water pool. In certain conditions, warm water may not be chosen, but most of the conditions therapy is done in warm water pool, so the temperature is different from that of the room temperature. The body can perceive that the touch, there's a constant movement of water on the body, and so the touch sensors are continuously stimulated, and because of the hydrostatic pressure, even the pressure sensors are stimulated. So water gives a relaxation effect by activating our reticular activating system, the system that's responsible for relaxation and for falling asleep. It reduces the sympathetic activity. So we see that, I had mentioned this earlier, children with autism have imbalance of sympathetic and parasympathetic system, and we usually see that they have overstimulation of the sympathetic system, or it is postulated that they have overstimulation or overworking sympathetic activity, and in water that can be suppressed, which allows them to experience the world and the water in a very different way in absence of all of the sympathetic activity that is going on. This helps to also reduce anxiety. One of the reasons is the plasma dopamine levels that are increased when in aquatic, when we are immersed in water. There could be several contributing factors, but it's shown that anxiety and depression can be reduced when given aquatic exercises. Water also secretes, immersion in water also secretes certain neurotropic factors. What it means is that there are some positive chemicals that are secreted in the brain which protect the brain from injury and help in repair and growth of the brain. So these factors are secreted more or better when somebody is immersed in water. So as I said earlier, it has been established that anxiety and depression can be altered, or there can be an effect on anxiety and depression when immersed in water. So to summarize what we just discussed, aquatic therapy can complement land-based rehabilitation to eliminate the limitations that we face on land-based rehab. It's very important to understand or it's very important to know that aquatic therapy complements land-based rehabilitation. It is not an option for land-based rehabilitation. It doesn't mean if somebody is taking aquatic therapy, they should not do land-based rehabilitation. It in fact means that land-based rehab and aquatic rehab should go hand in hand, because at the end of the day, we have to live on land. We are not aquatic beings. As much as we love water, we would need to come out and be on land for our functional activities, and therefore it's important that both aquatic and land-based rehab is done. And the benefits that we get from aquatic therapy is that better facilitation of the movements, risk of falls is negligible. Many children who have weakness, spasticity, loss of balance, they may fall on land. Even adults may fall on land, and a fall can be detrimental if on land. They can get hurt. But in water, the risk reduces. Plus, if they fall, the damage of the fall also is much less as compared to the land. The joint compression is reduced, so the joints are preserved better. There's greater degree of freedom of movement. There is more blood pumped back to the heart. There is more blood pumped back by the heart, so better blood supply to the whole body and the brain. So these are the multitude of effects of aquatic therapy that we see upon water immersion. Now, if water immersion itself has so many beneficial effects on the body, why do we need to take aquatic therapy? Or what is aquatic therapy? So aquatic therapy is using water and its chemical and physical properties to perform specifically designed activities given by qualified personnel to aid in restoration, extension, maintenance and quality of function for persons with acute, transient or chronic disabilities, syndromes or diseases. Simply put, it means using various physical and chemical properties of water for the treatment of various disorders by a trained professional. So there are different techniques in aquatic therapy. There is water-specific therapy, Badraka's ring method, clinical Aichi, Watsu, aquatic exercises. These are in the form of aqua aerobics, just aquatic exercises. There can be certain other relaxation techniques that can be used. There can be passive techniques that can be used, which all encompass under aquatic exercises. Finally, I cannot stress enough on how land-based therapy and aquatic therapy are not alternatives of each other. We cannot do only land or aquatic therapy, but it is teamwork. We have to do land-based therapy along with aquatic therapy. So, where can aquatic therapy be done? Typically, it is done in a therapeutic swimming pool. Therapeutic pool is built for therapy purposes. It is accessible. Patients who are not able to get in and out of the pool using ladder. So there's either a slope or a chair that can get them in and out of the pool. It is temperature controlled. It is closely monitored for its water quality. And regular checks are done to ensure that there is no contamination in the pool, chemical or biological. Public swimming pools can also be used as the water quality checks are maintained in these pools, and if the temperature is suitable, public swimming pools, open swimming pools can also be used for therapy. However, a country like yours, country like Maldives, presents us with another option of actually being able to perform aquatic therapy in a lagoon or in the ocean. So there are parts of shallow beds of ocean or the beaches where the slope of the ocean is not very steep. I have also seen in Maldives they have created certain sort of public areas where people can go and enjoy themselves and experience the fun of being on the beach and in the ocean without the risks of it. They barricade the water. There's only one port of entry, and they create a small sort of pool of water where we can go and enjoy. So these can also be used for therapeutic purposes with a caution. So we need to be aware that these water bodies, though it is natural water, which may have certain risks. The water is high in salt content, which will have a different effect on the body, but we can still use it for the treatment of our children. We need to explore that more. So in Maldives, we need to really experiment about how we can use the abundance of water that we have all around us for a more therapeutic purpose for our children. And I'm sure every child in Maldives goes into the ocean right from the young age, and they must be swimming in the ocean. They might learn swimming in the ocean itself. We probably don't need a swimming pool in Maldives. But so we can also use it instead of recreation. We can also use it for therapeutic purposes and to benefit our children. What are the contraindications for aquatic therapy? So can everybody get into the pool and take this treatment? So there are certain contraindications, absolute contraindications. If there are any skin infection, systemic infection, if somebody has fever, if there are any open wounds that cannot be closed with the appropriate bandaging to keep it waterproof, then we cannot take those patients or children in the pool. If they have very poor bowel bladder control, then we need to be very precautious while taking them in the pool. There are certain diapers that are available which can be used to prevent any accidents. People who are extremely scared of water, who have hydrophobia, it's not a contraindication, but we need to be careful. People who have poor respiratory endurance, respiratory strength, we need to be careful about introducing them in water as well. These are general contraindications. What are the benefits of supervised therapy? So I think I have stressed enough about what are the benefits of aquatic therapy. Why is supervision required? Because it is not possible for everybody to understand the effect of water, the effect that the water has on our body from within, and what effect it can have on our body from outside, and then how to best use it to get maximum advantage or maximum benefits out of it. So supervised therapy gives you that edge where a person who's trained as an aquatic therapist can give you a goal-oriented timed program tailored just for the child to improve their symptoms and impairments. How long should the therapy be done? So it differs from patient to patient. It's very difficult to give a generalized idea or guideline about how long the therapy can be done. Every aquatic therapist would individually assess a patient and then decide how many sessions may be required. However, what has been seen is that in autism, around 3 to 6 months of regular therapy done twice or thrice a week can give some meaningful or can show meaningful clinical change in the children. And in CP, something done over 4 to 8 weeks regularly at the frequency of 2 to 3 times a week can give a very significant and meaningful change in the children. What are the adverse effects of aquatic therapy? What are the adverse effects of aquatic therapy? So aquatic therapy per se does not have any adverse effects. It does not have any negative effect on the body, but we have to be precautious with certain conditions. If there are any heart conditions, if the children have seizures, then we have to be careful about that. If there are any blood pressure fluctuations or people have diabetes, because the metabolism in water increases much more than on land, and so we need to be precautious when it can adversely affect them if not taken care properly. So they may have hypoglycemia, sometimes reflections of water, and all the sensory stimulation that a child gets in water may trigger a seizure, so we need to be precautious about that as well. But apart from that, aquatic therapy is very safe when performed by a trained aquatic therapist. When performed by patients under supervision, it is a safe modality. So at the end, I would like to show you some videos. So this is a child who has dystonic movements of arm, unable to catch the ring when outside the water. However, when immersed in water, we can see that he's able to perform the movement more smoothly, and in this similar amount of time, he was able to perform this movement more number of times, almost 4 times. So this gives an opportunity for him to learn the movement better, and this is the effect of water immersion. We have a child who is not able to walk on land without support. So you can see the father has to hold him. The way he walks, there is a lot of trunk sway. The gait pattern is not very good. He's not able to walk very well, but in water he's walking independently, and the pattern is not as bad as on land. There's another child who has uncontrolled walking because of scissoring. He needs to be supported. So he was given some passive stretching. He was given some active exercises, and these are exercises that are just so these are movements that can facilitate better walking patterns. You can see the child was very easy, and then just in one session he was able to walk with the alternate leg pattern. So he's still not walking independently, he needs support, but he's able to walk much better. And you can see he's able to use the alternate leg pattern. Both the legs are moving separate from each other, unlike what we saw on land where they both were moving together. So the next video is of the child with muscular dystrophy, and what we are trying to show is the difference in one day that we perceived. Of course, it is not doesn't mean that the muscle strength or the strength of the body improved immediately after one session. It just shows the opportunity aquatic environment provides to a person. So he was able to stand with complete support because of all the deformities he had, and he was extremely unhappy about that. He was crying all the time. But in water, he was able to maintain good posture. He's not crying. It is difficult. He's struggling, but he was still able to maintain it. He's able to walk, which gives him a good boost. And then after the water session, when he was made to stand, he was able to actually stand without support. This is only after one session in water. It shows how the muscle recruitment can be changed, muscle patterns can be changed, how body that was not able to perform certain activities can perform these activities after just one session, by changing or giving the opportunity for the body to experience these movements. Finally, this is my aquatic therapy team. Without them, it would not have been possible for me to come here and present all of this information in front of you. So I would like to thank all of them for their contribution towards the aquatic therapy work. And I would like to thank everybody for being patient, listening to me. I hope I was able to give you some information about aquatic therapy, create some curiosity in your mind, intriguing, get you intrigued about what could be the potential of aquatic therapy, and motivate you to learn about aquatic therapy, practice aquatic therapy with your patients. After this, in the afternoon pool session, we are going to see certain activities being demonstrated in the pool. Good afternoon, everybody. I can see everybody is ready to get into the pool, and I'm quite excited about our session in the pool. Today we are going to focus on modified ways of entry into the pool and exits out of the pool, mental adaptation, and then slowly disengaging from the patients as they become more and more independent. So we are going to start with a completely supported entry approach into the pool. If they can sit without support, then we make them sit on the bank of the pool. We make sure that their thighs, half of their thighs are out into the pool, so they are just sitting on the edge of the pool. We stand in front of them, looking at them, keeping our hands in under their scapula or the shoulder blades, so they feel completely supported, while the patients can rest their arms on our shoulders. And we ask the patient to keep looking at us. So when I ask them to keep looking at me, they feel reassured, supported, and at the same time it helps to keep their neck up and it doesn't fall down in the water. And we gently pull the patient into the water while supporting them completely so that they don't dip inside the water. With this, we get a complete access to their body in 3 dimensions, and we can move them in a supported and comfortable way in the water. So the first and foremost we have to focus on is breathing control. So we give certain exercises that are focused for improving oromotor control as well as for improving breathing in the water. Once the patient is inside the pool, then we can start slowly disengaging from them. Different activities can be planned. We have to then teach them different rotational controls, do certain relaxation activities for them like Vatsu, or we can also engage them in different group activities. So a patient and a parent, or a patient and a special educator, a patient and teacher, or a patient and a therapist can form a pair, and in a circle or in different formations we can give them different group activities. So now I am going to demonstrate a small activity with a child. She has cerebral palsy, and as we can see on land, she is able to walk independently. She has difficulty balancing herself. Her knees don't lift off very well, so she's not able to bend her hip and knee very well. Her knees are crouching inwards. So there's a lot of pressure on her knees and ankles as she's walking. For this girl, I will choose a completely supported entry approach, as this is her first aquatic therapy session, and she will not be able to, if I pull her in the water, she'll be very scared. She has been into the pool, but suddenly dipping in her face in water may be quite daunting. So we will do a completely supported entry. We will give her some, I'll keep chatting with her. I will give her an opportunity to feel the water around her, be comfortable in the environment, and then slowly see how she is able to perform the movements. So as she gets more comfortable in water, I will try to bring her from the shallower depth to the deeper side of the pool, and then slowly see how she's able to walk in the pool, bring her back to the shallower end, and see if she's able to take weight on her legs, and how do the legs then move. And as we can see, there is a lot of hip knee flexion that we can observe as she is trying to walk. She is able to jog in the water as well. She's able to move her legs much faster than on the land, and this is the immediate advantage or immediate benefit that we can see already in the aquatic environment. I would really like to thank Imaduddin School and Department of Inclusive Education for giving me the opportunity and to come and speak to you all about aquatic therapy. I hope I have been able to give you a comprehensive idea about what aquatic therapy is, what are the benefits of aquatic therapy for our children, and I hope I have ignited the enthusiasm to learn more about aquatic therapy. Thank you so much.